Hi, it's Dr. JJ and I'm here on the set of Home and Family, and I wanted to briefly talk about Enterovirus d68. This is a virus that has made the news in the last month and a half, and for those of you who live in the Midwest, and now for those of us who live in California and on the East Coast, this rare respiratory virus is really wreaking havoc with our young people. Kids, babies, and teens are especially vulnerable because they've never seen this virus before and they have no previous immunity. And those kids with asthma and those kids who have pre-existing lung disease seem to be especially vulnerable. About 70% of kids that end up in hospitals with this respiratory virus have had some previous respiratory insult or asthma. So how do you know if your kid's in trouble? Because the good news is the majority of kids who have Enterovirus d68 just look like they have the common cold. And with those kids, you just treat them with fluids and rest, and if they've got a fever, make sure you keep them home for a good 24 hours until their fever resolves before you even think about putting them back in school. But what if your kid has a cold and then all of a sudden starts huffing and puffing? They're breathing faster, they're breathing with more effort, using all these muscles above the clavicles, the skin sucking in between the ribs. They're not eating, they're coughing so much they may be vomiting, or they're coughing so much they don't want to be active or playing, or their lips turn blue, or they get pale or listless. Boy, oh boy, should you be on the phone or in your car heading to your healthcare provider or an emergency room if it's on the night or the weekends. Because even normal kids with normal lung histories can get this virus, and there are going to be a small percentage of those kids who may have respiratory distress, and it's key that you understand what to look for. I'm going to demonstrate what wheezing sounds like, because for some kids you could actually hear wheezing, and so it's important for you to have a little bit of something in your head to know how to tune into your child. So here's what wheezing sounds like, and I'm going to get a little closer to the microphone so you can hear. Basically, you're going to hear a long, high-pitched sound on breathing on the way out. So a child who starts to wheeze sounds like this. Okay, and that is different from a child who may have croup, which sounds like So if your kid is barking, they probably have croup, and you probably are going to be heading to the emergency room for that. But I think if your child has a cold and then very abruptly you start to hear this kind of wheezing calliope sound coming out of them, best to get on the phone, best to get to your doctor, best to get some medical attention. So good luck with this. I think everybody's kind of shaking in their boots, but you know what the good news is that we've not seen any children die from this, but it has caused an elevated level of concern where wheezing and respiratory distress are now part of our American vocabulary this winter. So I wanted to give you some hints and tips to make sure you knew what to listen for and watch for. So be well, wash your hands, get your flu vaccines. Don't share food with folks. Don't shake hands or share cups with anybody who's sick. And if you don't feel well, stay home.